and Sandra Fitzpatrick, who's the clinical lead for inequalities for the vaccination programme. So Helen, Elizabeth and Sandra will be presenting this webinar on vaccinations. So I'll now hand over to them, and first of all hand over to Helen.
Great, thank you, Esme. So the first slide is basically what are vaccinations. So after clean water, vaccination is the most effective public health intervention in the world for saving lives and promoting good health. Vaccines prevent 3.5 to 5 million deaths each year from many diseases, including tetanus, influenza, and measles. Vaccines work with your body to build its own natural defences, thereby reducing the risk of getting seriously unwell from a disease. Next slide, please. So what is the difference between vaccinations and immunisations? So the words are often used interchangeably, and you'll be understood if you use them interchangeably as well. But technically speaking, they do mean sort of slightly different things. So vaccination is the act of getting a vaccine, and immunisation is the process of becoming immune or resistant to a disease. In this context, that's through vaccination. Next slide, please. So how do vaccinations work? This video gives a brief look into how vaccines give protection against a range of diseases. So I'll just mute so as we can play the video. Okay, great. Thanks, Esme. So getting vaccinated on time protects you and your loved ones from many serious diseases, including measles, mumps, and the flu. Getting vaccinated also helps stop the spread of disease to those who aren't able to get vaccinated, so you're protecting your community as well. The smallpox vaccine was the world's first successful vaccine, protecting against the serious and often deadly disease of smallpox. The smallpox vaccination was so successful that in 1980, the World Health Organization announced that the disease had been wiped out or eradicated. Next slide, please. So getting vaccinated doesn't just protect you against disease, it protects your community as well. When less people are vaccinated, like in the diagram at the top of the screen, more people can get sick, which means more people pass on the disease, so it spreads through the community or the population. When the majority of people are vaccinated, more people are protected against disease. This means less people get sick and pass on the disease to their friends and family, thereby protecting their community. To control the spread of a disease like measles, for example, 95% of the community needs to be vaccinated to create herd immunity, which means the spread of the disease is contained or controlled. Next slide, please. Thank you. So how many people are fully vaccinated in England and how many are vaccinated in Birmingham? So next slide. Thank you. So we know it's important that as many people as possible are vaccinated to protect individuals and to protect the community, and that when less people are vaccinated, there's a risk of more people getting unwell and spreading disease. So the picture on the slide shows some of the immunisations given to children in England, and that they're all below that key target of 95%. It also shows that year on year, less children are receiving their immunisations, meaning more children are at risk of becoming unwell from those diseases and potentially spreading disease through the community. Next slide. So that was looking at England, but what about Birmingham? So on this slide, we're looking at the MMR vaccine, which protects against the diseases of measles, mumps, and rubella. And in Birmingham, this is well below that 95% herd immunity rate that we've been talking about. In the 2021 to 22 period, only around 76% of children in Birmingham have been fully vaccinated by their 5th birthday. Next slide, please. We also know that from recent reporting, measles cases are on the rise in England, which is very concerning because measles can cause life-threatening illnesses such as meningitis. As measles cases are on the rise and less people are vaccinated, this increases the risk of people getting ill from measles, which means it's really important to ensure that everyone is up to date with both doses of the MMR vaccine to protect yourself and your children, but also to protect your community by getting closer to that 95% target. The next slide. Yeah, so we can look at another example in Birmingham, this time looking at the COVID vaccine. So most areas of Birmingham have fairly low uptake of the first dose of the COVID vaccine. And this number changes a lot depending on what area of Birmingham you're looking at. For example, in Holyhead, around 50% have had the first dose of the COVID vaccine. And in Sutton Four Oaks, around 89% have had the first dose. Next slide, please. It's thought that there are 3 main factors that affect whether people decide to have a vaccine or not. These factors are confidence. So do people believe the vaccine works? Do they believe it's safe? Do they trust their healthcare workers and others who make decisions about vaccines? The second is complacency. So do people believe that these diseases pose a risk and that these diseases can affect themselves and their community? And the last one is convenience. So is it possible for people to be vaccinated? Have they got the time to attend a vaccination appointment, etc.? So some examples of what these 3 factors might mean to people are in the boxes on the right-hand side of this slide. So next slide, please. I think I might be handing over to Sandra and Lizzie at this point.
Hi. Next slide, please. So this is the UK routine immunisation schedule, and like me, I'm sure many of you can't actually read it, but there is a link that can give you more, deliver it in more detail. But it just shows the complexities of the schedule because it's from 8 weeks up to the age of 70. Next slide, please. So this slide is for babies under 1 year old. So they start having the vaccines at 8 weeks and continue up until 14. But for this one in particular, it shows the breadth of vaccines. There's a 1 in 6 vaccine, which has obviously got 6 parts to it. So children, when they've had the vaccine, obviously have a start to build their own immunity to most of the common things that could make them ill. Next slide, please. Again, this is showing from age 1 to 14 and picking up on the 3 years, this MMR, which is the second dose, once they've had the second dose of the MMR, they're actually getting up to 98% cover from not getting the infection. So it's really important that we vaccinate our children. Next slide, please. So how can I check if my child is up to date with their vaccines? Well, the easiest way you can check if they're missing any vaccine is by checking the child's personal health record, which is commonly known as the Red Book. They can also call their health visitor or contact the GP practice. Children and young people who have missed out on their teenage vaccines can contact their school nurse through the school nurse immunisation team or again their GP practice. it's important to stress that if anybody has actually they've missed their vaccine, that just by making rescheduling of the appointment, that the vaccines can be given again. Next slide, please. Vaccine during pregnancy. Well, what's offered? This flu vaccine is offered to all pregnant moms between September and March. And from 16 weeks, the whooping cough, and the COVID-19 can be given anytime during pregnancy. Having spoken to a lot of pregnant women, one of the two main fears were that the vaccine itself was being passed through the placenta or through mom's breast milk and the baby to baby, when actually it's the antibodies that mom makes that is passed through the placenta and through the breast milk, which is exactly what you want, so the baby is fully covered. Next slide, please. I'll hand over to Liz.
Thanks, Sandra. So I'm going to give an overview of the older adult vaccination. So vaccines are especially important for older adults. As you get older, your immune system weakens and it can be more difficult to fight off infections. You're more likely to get diseases like the flu, pneumonia and shingles, and have complications that can lead to long-term illness, hospitalisation and even death. So I'm going to give you an overview of some of the older adult vaccinations. Next slide, please. So I'll start off with the COVID-19 vaccination. So the COVID-19 vaccination programme continues to reduce severe disease across the population while helping to protect the NHS. The vaccination is safe and effective, and the vaccine gives you the best protection against COVID-19. There are several different COVID-19 vaccines in use, and they've all met strict standards of safety, quality and effectiveness. The spring COVID-19 booster campaign ended on the 30th of June, as well as the primary course of COVID-19, except for those who are 6 months to 4 years old in a clinical risk group. The COVID-19 vaccination offer moving forward will be more targeted during vaccination campaigns to protect those at increased risk of severe COVID-19. If you are at increased risk, getting a seasonal COVID-19 vaccine is the best way to protect yourself and others. Research has shown the vaccine helps reduce the risk of getting seriously ill or dying from COVID-19. It also reduces the risk of catching and spreading COVID-19, and also protects against different strains of COVID-19. So seasonal boosters will be offered because protection fades over time. There is a chance still that you might still get or spread COVID-19 even if you have had the vaccine. So currently we are waiting further guidance in regards to the autumn campaign and the date the campaign will commence. However, for those who become newly severely immunosuppressed, between seasonal campaigns should still be considered for the COVID-19 vaccination in the interseasonal period. Some more information can be found on the link that's also on the slide. So accessing the COVID-19 vaccine, you'll be able to have a vaccine from your GP, your pharmacies. When the campaigns are running, we have them at the hospitals, which include Queen Elizabeth, Solihull, Heartlands, Good Hope, and also our COVID-19 vaccination mobile units. So during the seasonal campaigns, we update our walk-in site regularly to inform where the vaccination mobile units will be during them campaigns. Next slide. So moving on to the flu vaccination. So flu occurs every year, usually in the winter, which is why it's sometimes called seasonal flu. It's a highly infectious disease with symptoms that come on very quickly. Healthy individuals usually recover within 2 to 7 days, but for some, the disease can lead to hospitalisation, permanent disability, or even death. Flu is unpredictable, and the flu vaccination gives the best protection. There are different strains of flu virus, and the strains that are most likely to cause illness are identified in advance of the flu season. Vaccines are then made to match them as closely as possible. Even if the vaccine doesn't perfectly match a strain, it usually provides some protection against it. The vaccines are given in the autumn, ideally before flu starts circulating. There are alternative flu vaccines available for those who may not accept the use of porcelain gelatine. You can discuss these options with your nurse or doctor, as well as flu vaccines that are egg-free if you have specific allergies. So it's best to have your flu vaccination in the autumn or early winter before flu rates increase. It's important to remember that you need the vaccination every year and to not assume that you are protected because you had one last year. So you're able to access the flu vaccine from your GP surgery, a pharmacy offering the service if you're aged 18 or over, and some maternity services if you're pregnant. And sometimes you might be offered the flu vaccine at a hospital appointment. Next slide, please. So moving on to the pneumococcal vaccine, which protects against serious and potentially fatal pneumococcal infections. It's also known as the pneumonia vaccine. Pneumococcal infections can lead to pneumonia, blood poisoning, and meningitis. At the worst, they can cause permanent brain damage or even kill. Anyone can get a pneumococcal infection, but some people are at a higher risk of serious illness, so it's recommended that they're given the pneumococcal vaccination on the NHS. The vaccination is offered to adults aged 65 and over and adults with certain long-term health conditions. This is because you have an increased risk of becoming unwell with the pneumococcal infection. The vaccine can be accessed through your GP, and they normally do contact you when you are due it, but if not, obviously you can get it through your GP. Next slide, please. So finally, we have the shingles. So shingles isn't like other infectious diseases because you don't catch it from someone else. Most of us had chickenpox when we were young, although some of us will not be aware that we've had it. If you did have it, then the virus that caused it can stay in your body for the rest of your life without knowing it is there. If the virus reactivates, it causes a disease called shingles. Shingles can be very painful and tends to affect people more commonly as they get older, and the older you get, the worse it can be. So for the pain caused by shingles can last for many years, and it can really affect your life, stopping you from doing all the things that you usually enjoy. About 1 in 5 people who have had chickenpox develop shingles. It is more common in people aged over 70 years. People under 70 years of age are at lower risk of shingles, but will become eligible for the vaccine when they turn 70. People aged 80 years and over are not eligible for the shingles vaccination because the vaccine becomes less effective as people get older. However, if you are worried about the shingles, obviously we recommend that you speak to your GP. And as you become eligible, as you turn 70 years of age, you'll remain eligible up until 79 years of age. Also to mention, the vaccine cannot cause shingles in healthy people. And if you want more information, obviously just check out the NHS website around the shingles vaccination. Currently, your GP surgery is the only place that you can access the shingles vaccination. Next slide, please. So here's a table that just summarises the vaccinations that I've just mentioned and the age at which you can receive the vaccine. If you have an ongoing health condition like diabetes or heart disease, getting vaccinated is especially important. Vaccines can protect you from serious diseases and related complications, so you can stay healthy as you age. So getting vaccinated can keep you, your family and your community healthy. I'm passing back to Helen now.
Great, thanks, Lizzie. So yeah, next slide, please. So travel vaccinations aren't on the routine schedule that we showed you a few minutes ago, but it's still really important to check if any vaccinations are needed for the areas that you're going to. Travel vaccinations are important to protect you against diseases found in other countries that aren't covered by the UK's routine schedule. You can find out which vaccinations are recommended for the areas that you're visiting by clicking the link on this slide. Next slide, please. So this is about tetanus. This is caused by a bacteria getting into a wound and is a serious and life-threatening condition. The best way to avoid getting tetanus is to make sure that you're vaccinated against it. Tetanus vaccines are included in the routine schedule that we've previously spoken about, and the vaccines are given to babies as part of the 6-in-1 vaccine, given to 3-year-olds as part of the 4-in-1 preschool booster, and given to teenagers as part of the 3-in-1 teenage booster. If you're not fully vaccinated, or it's been a while since your last booster of the tetanus vaccination, you may need a booster vaccine if you have an open wound, especially if the wound is deep or if the wound is dirty. You can check with your GP practice, who can assess the wound and decide if you need a vaccination. Next slide, please. So university students as well can also be at an increased risk of disease as they mix with large numbers of other students from around the country and from overseas. That means it's really important for students to ensure they're up to date with their vaccines and to catch up with any they've missed before they head off to university to protect themselves against disease. So students should make sure they're caught up with the following vaccines, and these are also part of the UK routine schedule. So these are the meningitis ACWY vaccine, which is initially offered to 14-year-olds, the MMR vaccine, which is initially offered to children sort of pre-primary school age, and the HPV vaccine, which is initially offered to those aged 12 and 13. So I think I'm handing back over to Lizzie for the next couple of slides. If not, I can just go through them.
No, sorry, that's fine. That's fine. So yeah, so it's important that vaccines are given on time for the best protection, but you can still catch up on most vaccines if you do miss them. So if you would like to book a vaccination, we just recommend that you call your GP. Who'll be able to provide further support and guidance. There are also links on the slide if you require further support, if you need to register with a GP, and how to access some vaccinations through community pharmacies. Next slide. So vaccinations for those born or who live outside the UK. So it's important to register with a GP practice and have any vaccinations on record transferred over to your GP practice, and top up on other necessary vaccinations, as vaccinations offered differ from country to country. Also, again, for further information, ensure you're registered to a GP practice and set up an appointment with a healthcare professional to see which vaccines you may need to catch up with the current UK vaccination schedule. Next slide, please. So, worried about vaccination. So vaccination is the most important thing we can do to protect ourselves and our children against ill health. Some things you need to know about vaccines are they protect you from many serious and potential deadly diseases, protect other people in the community by helping to stop diseases spreading to people who cannot have vaccines. They undergo rigorous safety testing before being introduced, and they are also constantly monitored for side effects after being introduced. Sometimes vaccines can cause mild side effects that will not last long, and finally they reduce or even get rid of some diseases if enough people are vaccinated. So speak to your GP or practice nurse if you're worried about you or your child having a vaccine. You can also check out the NHS website for further guidance and information around vaccinations. I'll pass you back on to Helen.
Great, thank you. Yeah, so what can we do to help? And this is where the Bolder Healthier champions come in. So next slide, please. So your role as a Bolder Healthier champion is to talk about the effect that immunisations can have in our communities, and to encourage and support people to follow the routine vaccination programme. Improving vaccination uptake within your communities is really important. So we're asking that as champions, you share these key health messages that we've discussed with you today with your communities. You can also connect people to resources that can help them or someone they know. And finally, you can feed back to us. You can tell us if our information's useful, what other information you think might help, what else we can do to get the message across, or if there's a particular topic you want us to focus on. Next slide, please. It's important to remember that talking should always be done with the intention of helping connect people to the right support and not taking on the responsibility of offering professional guidance. Always use the approved information and try to remain neutral. Don't get personally involved with the people that you're trying to help. Next slide, please. So what do you talk about? You can spot people who may need your support. You can share these key messages and encourage people to accept the offer of vaccination. And you can promote these webinars in your network. So here are a few examples or suggestions for how to talk about vaccination within your community. You could ask if they're up to date with their vaccinations, if they know how vaccines protect us against disease, or if they know what vaccines they or their children are eligible for, with some more examples on the rest of the slide. Next slide, please. So this is an example of how you can offer some brief support and help in your everyday interactions without getting personally involved. It's called the Ask, Advise and Act model, and you can offer brief and immediate support to find out what help is needed and then direct the person to the resources that we've given you. Next slide, please. Sometimes you can help someone best by offering practical support, especially if they're struggling to find the time to research the information for themselves. In this case study, a Bolder Healthier champion is talking to their friend whose young child is due for some vaccinations, but they're not sure if they want to get their child vaccinated. Next slide, please. The Bolder Healthier champion points their friend to some reliable information about vaccines, which may address some of their concerns. Next slide again. Bolder Healthier champions do the really important job of connecting people to the resources available, whether through web pages, services, or through voluntary organisations. Next slide. And this slide brings together a directory of resources about immunisations. And this may be helpful to support you in your conversations with your community and to help connect people to the right information that they might need. Next slide, please. We also want to know where more help is needed so we can continue to improve the support for citizens. As the eyes and ears of the community, you can tell us where more help is needed and how best to provide it. You can email us or connect through social media at any time. Next slide, please. Yeah, so finally, thank you for volunteering to be a Bolder Healthier champion. We hope that you're enjoying these sessions and enjoying supporting your community to improve their health and well-being and promoting positive health. Your role as a Bolder Healthier champion is to share the information into your communities to encourage and support health and well-being. Our champions are advocates for important health messages in Birmingham by distributing this information into a wide range of communities and networks. And we support you through monthly themed webinars and tailored resource packs. We've previously covered topics such as physical activity and how it can be incorporated into our daily lives, the cost of living, and more recently, diabetes. So if you know someone who might be interested in taking part, then please encourage them to find out more by searching Bolder Healthier Champions Birmingham City Council, or by sharing the link with them when you receive this slide deck. Next slide, please. Okay, great. So yeah, thank you for joining us today. I think I'm just going to hand back to Esme.
Yeah. Yeah, so thank you for presenting that. I think that was very, very good, and hopefully it will be of some use to you as Bolder Healthier champions. So I just want to open the floor up for